It's winter, I dream of summer. We go places, magic and wonder. Starlit faces never look somber, no. Can you feel my heartbeat racing? Memories of heartbreak fading. I reach out, these arms embracing. You open up your eyes, you see it too. You lift my spirits when you hold my hand. Anywhere we land, it's like our toes are in the sand. You got my feelings set to overload, spilling over more until I overflow. I can't count to one Mississippi without needing you to be with me. Life's so complex, all I want is me and you. Can you feel my heartbeat racing? Memories of heartbreak fading. I reach out, these arms embracing you. They don't have a lot worth chasing. We go far beyond those spaceships. Open up your eyes, you see it too. You lift my spirits when you hold my hand. Anywhere we land, it's like our toes are in the sand. You got my feelings set to overload, spilling over more until I overflow. Can't explain what can't be explained. Is it so strange to not be the same? Get along just fine. She'll light the match. Oh, she's like an animal. It's in her blood. She will turn every chain.
with for this one. Okay. And from our tech corner, the issue so hard over the course of Pacific Partnership Main Planning Conference this week. Again, I'm Lieutenant Commander Brendan. Unfortunately, we're going to brief a little bit out of order today for a couple of different reasons. Usually, we prefer to give you these in mission order, but between tech issues and the fact that John had an urgent matter, he had to take
12-foot draft, we should be good to go. Next slide. Oh, sorry, go back one. So they don't have a crane available, but they do have their own stevedores that are readily available. Next slide. So we're looking at 2 islands here, two to three, depending on basically refurb. They have to determine whether it's actually refurbishable or if it just has to be completely rebuilt, as well as the demolition job of a power plant, which again may or may not be doable. I'll have the engineer speak to that when they get to their slides. And then down here is the Majuro Airport, right, where they would do their conferencing for the. And this would be the hotel that we're staying at. This is the one that has 14-person conference room available, as seen down here, and it's fairly close to the airport. They have vans that we can rent, and it's only 2. So back and forth based on that. And the main thing that'd be moving is our ROM. So if we kept to the 21-day ROM that they currently have, we'd have to start our flights all the way back in July. Get our medical evaluations done on the 5th and 12th day and get those pushed out. After the fact, the HNEO and the HADAR, as well as any of the Coast Guard conference that they want to put on. I'm not sure if they are going to be able to support the 21-day ROM or not. We're all hoping that the ROM is going to be cut down to maybe 7 or 3 days, but that hasn't been firmed up yet. Just 14 days out at sea, sir. To Kwajalein is only 4. Exactly. Mitigate that. Next slide. Okay, I'm going to pass this over to our engineer.
Thank you very much. Good morning, everybody. Mike Sadowski, mission engineer. Morning, sir. All right, so we discussed the pier. This was thought to possibly fall under the Pacific Partnership umbrella. However, I would say due to significant environmental studies that need to take place on this project, the environmental impact statement would take upwards of a year, maybe 2 years. It's not necessarily realistic to have it, I would say, fall under perform that site assessment on it. It's completely corroded. And then you'll see some of the concrete has been eaten away on the next slide. Next slide. So some of the concrete in areas completely degraded. Sheet pile, you've got holes in the steel up there on the top left. Again, top right showing the same thing. Next slide. And as far as demolition of some of the power plant goes on Enber, again, same sort of scenario here. For demo of a power plant, we're thinking possibly if there was PCBs, polychlorinated biphenyls, you need to take that into account. We have an environmental engineer that will be going out to perform a site assessment from NAVFAC to take a look further at this project. Next slide. So again, more information on the demolition. Where our plan is to demolish 3 structures on the 3rd island in order to protect the community, deteriorating infrastructure, and prevent spread of disease. Cost is TBD, and that would be based on the environmental impact statement or study that gets performed. Duration currently estimated at 1,300 man days. Next slide. So again, you can see concrete completely deteriorated, rebar exposed up top, a lot of debris all over the site, but we won't know more until we've got that site assessment performed on the demo. Yes, sir. So I don't know if this one is currently active. I don't believe so. This would be demo, yes, sir. Next slide. Just additional photos on the power plant, so extremely degraded. Next slide. Okay, and then the International Airport Terminal. So right now the terminal is shut down from operation. Currently the goal is to repair damage to the terminal, which has halted services again. Building is considered in high risk of collapse. So the goal there again is to send out a team. We do have a team currently in RMI. We want them to take a look at the site, give us more feedback, and go from there. I can't say a yes or no on this project yet. We are just waiting the site survey. Next slide. Some concerns from the engineering line of effort. With the demo, biohazard, possible PCBs, an environmental impact statement needs to be performed. With regards to medevac support at the project, there's force protection at project sites, requires further coordination with host nation. That's all that we have on concerns for engineering. Next slide. All right, Hadar.
Sir, how's it going, sir? So for the HADR, what they've done in the past, and their intention, and this is the Coast Guard civilian, is to send out 2 to 3 people max, and then speak with, do training and classroom sessions with their port services for search and rescue, and so that would be reviewing their SAR plan that was signed in 2018. As well as possibly doing actual practice out at sea. And this is something that if we do end up having the TAMR there, could potentially help out for SAR patterns. Yes, sir. It is the Disaster Management Office official. Yes, sir. And so the idea would be to do this meeting at the conference room inside the hotel, Raymarsh Hotel, because it can take 14 people. And then, if required, go and do actual practicals. Next slide. Medical, ma'am.
Good morning, sir. I'm Lieutenant Commander Kim Hendricks. I'm the medical team lead for RMI. Next slide. All right, so comms have been a little bit challenging, establishing exactly what the RMI is requesting in terms of medical events, but we do plan on putting together a medical team of approximately 13 packs, that's still a little bit in flux, of varying subspecialties so that we can offer a variety of events. Next slide, please. So the island has 1 major hospital that we are hoping to partner with. Next slide. So this is the composition of the U.S. medical team. We plan to send a surgeon, 2 general practice physicians, so a nice variety of medical personnel to offer a wide range of events. Next slide. These are the potential topics that we can offer, everything from trauma care to chronic diseases, maternal health, food and water safety, animal care, eye care, public health related topics, as well as ventilator training and veterinary specific topics. They are probably one of the most versatile members of our medical team, so there's a lot of offerings that we can have for RMI. Next slide. These are just some examples of some courses that we can offer. Life support courses are great, they're easy for us to teach, and it's a high yield and high benefit for the countries. Next slide. That's all I have. Thanks, sir. HNOE.
Good morning, sir. I'm not sure if there any other slides. Is that it? No. Beautiful. And that is exactly what we are offering. we're gonna have, since we're gonna have the other group in the Philippines and Vietnam, well, we have a 5-piece brass ensemble that is going to be augmented by 3 other musicians from the Australian Navy to have that joint element. I spoke with Major Parsons yesterday on the phone. I told him that we are ready to assist in any way possible, so we're hoping that they come back and say, yes, let's have the band, and we're ready to perform. Thank you.
All right, sir. So some of the RFIs, we did get to finally speak to Major Parsons yesterday, kind of our person in that AOR. And so he's in the Army. I'm not sure exactly who he works for specifically. So each LOE kind of has their own few RFIs. So for engineering, if they do end up doing any of those constructions in the northern part of Kwajalein, what kind of equipment's already there? Can we do the site survey with the team that's currently there right now? Are they going to allow them to move around because it is not in the exact base that they're located currently? And then for medical purposes, when you're doing any of those events, what's the easiest way to get someone in and out? Because you would have to ferry to that small island. Does it make sense to have medical on the island or on that closest airfield 10 minutes away via ferry? Especially for the demo project, if they do end up doing that. For the medical LOE, there's one main hospital, but there's a secondary hospital, and they did originally bring up that they were interested in medical at some of the outer islands, which creates an entire new issue of how do we get there. For the HADR, basically what additional vessels outside of what we bring could potentially participate in that. And then for the HNOE, where do we play these instruments? If it's only a 5-person quartet, are we going to go or stay somewhere where it's mass populated and we can use power, or are they going to travel up and down the atoll and do the more acoustic stuff? Next slide. General RFIs. What types of communication are we going to have to get cell phones or pucks for the contract for food for participants? How fast can we turn this on if they decide that they do want us in at the last minute? Major Parsons spoke to the PAC Fleet rep and basically said that he'll have that answer within 2 weeks on whether or not they're actually interested in us coming. And then as a last case resort, do it would be a 21-day commitment, or 14 if you've sailed in. So if you guys can't support that, then
Maybe we could use the RMI U.S. Embassy personnel to help us with the PA, photo taking. That might reduce a little bit of the MC burden as well. Okay, thank you. Any other questions from the group? Go ahead.
Thank you, sir. One of the RFIs for medical has to do with vaccinations. Now, I know with most countries that is a no-go, and there's many reasons for that, but Marshall Islands? Okay, wonderful. Marshall Islands is a little unique, so we would like to explore that option. Well, with Marshall Islands, their vaccinations come from our CDC. Our healthcare we're a little bit responsible for that population, healthcare-wise, and so it's a unique situation where their vaccines come from a U.S. entity, so that is something we may actually be able to participate in, providing vaccinations. It's right about 50%. I don't know if they have a stockpile, but the issue is the remote islands have very poor vaccination rates. They're having a hard time getting the vaccines to those remote areas and giving those out. So it's something we would like to explore. That is true, sir. Yes. Understood. Thank you. Yep. All right. Thank you, sir. We will look into it further.
Thank you to the team for the Republic of Marshall Islands. Just a brief pause while I replace the batteries in the microphone and we swap over to Palau. Palau will be up next, then we'll follow up with the Federated States of Micronesia. Short count test 1, 2, 3, 3, 2, 1, test complete. Okay, we're going to bring up Lieutenant Chris Fernandez, our OIC for the Republic of Palau.
Morning, everyone. I'm Lieutenant Chris Fernandez, Fibron 3. I'll be the OIC for Palau. Next slide, please. So Palau, like some of these other nations, is made up of several islands. There's about 340 islands. The island we will be going to is Koror, which is one of their states. Also, their largest city is located there. Palau has a total population of about 17,000. As you can see, the large majority is in Koror. Next slide, please. So Malakal Port is their primary commercial port. It is too shallow for the Mercy to pull alongside, so Mercy will have to anchor out. The picture to the bottom left is the commercial port. The picture in the middle is their ferry port. Next slide, please. Also, there's one international airport in Palau, also located about 20 minutes from where the Malakal port is located. It's a 7,000-foot runway. Flights into Palau from the United States come via Guam. United Airlines is the one that services that route. The flight schedule for that airport is posted the month prior for the following month. And then what it looks like is flights are all on Mondays and Fridays. They arrive at 0030 in the morning, depart at 0145. Next slide, please. So going over their COVID-19 status, so the country is open for travel. However, because the population is so small with their 1,419 cases, that's approximately 8% of their population. 97% of their population is vaccinated. The procedures for entering the country are verification of your vaccination status as well as a negative COVID test. As for facilities, the Palawan government maintains a list of approved accommodations, facilities, and transportation throughout the country. Also to note, so Palau in general did not have any issues with COVID through 2019, 2020, and the majority of 2021. It's only recently that they've had to deal with this COVID outbreak. So majority of their government resources are focused on this COVID outbreak. And as you see, as we plan ahead, we haven't heard too much as to what the country wants for our different lines of effort because they're focusing mostly on this COVID pandemic. Next slide, please. So our recommended DV events, if we intend to have an opening ceremony and a closing ceremony, intend to have people there for that. And as well as our tabletop exercise, we're planning on having multilateral cooperation, so that would be also a good opportunity to have a distinguished visitor there. Yes, sir. Next slide, please. So these RFIs, it's a very short list. However, it's because we don't know what the country wants from us. So right now we're planning as to things we could potentially provide, but haven't heard what they would like for us to provide. So for medical, what are they requesting of us? You'll see on the medical slide, but there's only one major hospital in Palau, and there's outlying clinics. So one of the concerns is if they want us to go see those outlying clinics, how do we get our doctors there? Sir, so once again, they're focused on that their COVID situation right now. Some of these offices are an office of 1 or 2 people, and they communicate through Lieutenant Commander Saavedra, which a lot of us have been talking to. I don't remember his billet. Yeah. Yeah. So he's the SCO for that region, sir. So the communication funnels through him to us, sir. But if the government is preoccupied, they don't have the ability to provide him those answers, sir. Yes, sir. And so moving on to the HATER. So confirmation from the host nation as to the subject matter for the tabletop exercise. We're focusing on SAR because it accomplishes a lot of the objectives that all these different organizations want to move towards. We just have to get confirmation from them. As you'll see as well, we're planning for an underway portion of that SAR exercise. So what is that schedule of events going to look like? Also, simultaneous participation from Taipei and Japan during the tabletop exercise. We don't expect it to be possible during the underway portion, and I'll brief that later as well. And then we still don't know from Taipei what asset they're intending to bring down to the area. For engineering, once again, what are the requested services from us? And for HNOE, once again, requested events, transportation of the band and equipment, and then the venues at which to perform at. Next slide, please. So we're going to start with HADR. Next slide, please. So there's a couple objectives we want to meet. So we want to do a combination of a tabletop exercise as well as a field exercise. We want to utilize the capabilities of the new Palauan Joint Operations Center that they've just stood up, as well as to facilitate helping out the training objectives for the Coast Guard, also to perform a mass rescue operation, which we believe would be the underway portion of the exercise, sir. For the assets, we have Coast Guard, Mercy, the Center for Excellence in Disaster Management, the Japanese destroyer, whatever forces Taipei decides to bring, and then Palau, once again, their Coast Guard and their Joint Operations Center. Nothing to report for external support and coordination, sir. Next slide, please. So broad SOE, so 14th and 15th is what we're planning towards for the tabletop exercise. That'll facilitate the Palauan government, the Coast Guard, our civilian counterparts as well as our Japanese counterparts. Then moving on to doing a 2-day underway exercise. Reason it's 2 days is 1 day will facilitate us participating with Taipei, and the other day will facilitate us participating with Japan. Correct, sir. Next slide. Medical. Next slide, please. So for medical, once again, Mercy is anchoring out. So we have the entire capability of the Mercy to provide. However, we do not know what they're asking for. So they have different bureaus that fall under their Ministry of Health. They have Bureau of Hospital and Clinical Services and Bureau of Public Health. Still waiting, once again, an answer for those. And in terms of capabilities, Palau has one national hospital that has the capacity of 80 beds. So we don't know, based on their COVID situation, how many of those beds are taken up with COVID patients and or what other services they provide. Right now, our intent, what it sounds like, is to support their doctors on the ground, and based on what services they ask from us, potentially bringing patients onto Mercy for other services that don't include the COVID management. Yes, sir, but not including the Mercy, sir. Yes, sir. And then as for event types, it depends on, once again, what the country asks of us, sir. Next slide, please. Any questions or comments?
Morning, I'm Lieutenant Fuentes, Ops on the Mercy. Do you expect do you plan for the Mercy to be underway and participate in the FDX portion?
Not at this time. Yes, sir. It depends on what's necessary for the medical line of effort, sir. I don't have an answer for that at this time, sir. Yes, sir.
Thank you very much for your presentation. If Mercy cannot attend FTX on 18 and 19th July, we would like to have photo exercise after Mercy departed from Palau on 20th July. So just photo exercise purposes. That is our request.
Any other questions? Thank you for your time.
Absolutely, wholeheartedly endorse the applause. All right, we're going to begin with Lieutenant John Howe, who's our country OIC for the Federated States of Micronesia. John?
Morning, everyone. Lieutenant John Howe. I'll be covering the Federated States of Micronesia. So next slide, please. Agenda laid out here. We'll address a couple things as we continue on through the presentation. Next slide, please. So FSM overview. Government Micronesia. It's a unicameral Congress. Much like many of the other nations that we've covered, it's spread over many islands. It consists of 4 states: Yap, Chuuk, Pohnpei, and Korte. Together they combine across 607 islands. There are no non-residents allowed entry at this time. Speaking with some of the leads yesterday, the country will most likely readdress this policy in 60 to 90 days, but they did not have a clear outline as to what the revised policy would look like. They're going to be basing that a lot on Palau and Guam's COVID trends, but the earliest they would readdress that is in 60 to 90 days. So next slide. Some of the climate averages, basically it's going to be hot while we'll be there. Next slide. So this is the main island that we would fly into, Pohnpei International Airport, serviced by United Airlines. It's a hopper flight 3 times a week. In each directions, there are additional airlines, but those are charter airs. Fly in on the northern part of the island, and then it's connected via causeway to the main island. And this is where the capital is on Pohnpei. Next slide. There would be an additional line of effort potentially on Yap. Yap is serviced by United Airlines via Guam. So kind of same as before, serviced by United with additional chartered airlines. However, to highlight, there are no flights to either of these locations due to COVID restrictions at this time. Next slide. FSN Telecommunications. There's a single telecommunications company. There are prepaids available. Coverage is good on the main islands. However, once you get to the outlying islands, there's limited to intermittent coverage. Next slide. So kind of the site I'm looking to do while we are in the FSM on Pohnpei, kind of the key lines of effort would be engineering. There would be a school renovation down on the southeastern portion of Pohnpei. Pollution, again, in the main city up there. Question basically to the folks on the ground what the country would like with regards to host nation outreach, but we don't have a response yet with regards to what they would desire. We kind of outlined we would have 4 to 5 members coming on doing subject matter exchange, playing for schools, high schools, those kinds of things, and we're still waiting to hear back on what the country would want if we are able to get on island, sir. So we'll adjust as needed for that, sir. Yes, sir. I'll have to follow up on that, sir. Yes, sir. And then for Yap, specifically to this one, there's an engineering, another school renovation that the CV team would like to conduct if they are able to get on island. Next slide. I'd have to look at the specifics. Most people speak English, but there are several local languages ranging. I'd have to look at what each island is, sir. I'll follow up on that, sir. For the engineering slides, next slide. So for this one, that's Pohnpei Elementary School. This would be Naval Mobile Construction Battalion 4, as NMCB 3 would have turned over. Specifically, it would be an elementary school renovation. They've already got an existing scope of work. And however, one of the main issues is NMCB 3 cannot get into a country to perform the construction. And then that's kind of the highlight. It's at a standstill. The scope of work is outlined, so they're familiar with what they need to, but they're unable to get on island to complete the scope of work. Next slide. Yap High School shower renovation, similar story. However, in this situation, they don't even have a good idea of the scope of work, so they would need additional time to figure out what that is. One of the big asks, if we are able to get on island and the CVs aren't, is to go to the site and get a better idea of what the scope of work would be for the CV team, sir. Next slide. Engineering concerns highlighted here, lack of site surveys, FP and medevac support at the projects, and then finally the material lead time. So one of the highlights here is it's about a 60-day lead time for materials from when they basically execute a contract to getting the materials on island. So that's kind of going to be the limiting factor for if we are able to execute these while we are on island or just execute these concurrently after we leave the island and the CVs are still trying to complete these projects. Next slide. Next slide. So for HADR, in this case, we would be looking to improve interoperability with FSM, increase SAR proficiency. So the Coast Guard team has a scalable package, approximately 4 to 5 people that they could fly into the island. It would be 2 to 3 days of classroom and tabletop exercises with a 1 to 2 day live event, and we could conduct BTC training as a last resort. Additionally, we would be looking to tie in the Orange Boat Initiative, where a Coast Guard cutter would bring orange paint to help paint some of the local boats to make them more easily visible from the air during SAR missions. So some of the U.S. assets in this case would be 5 packs from the U.S. Coast Guard. Medical assistance is required, and then from the FSM, it'd be from their local fire department and their emergency operations center. Our capabilities, there will be a U.S. Coast Guard cutter on patrol in FSM at the time, so we would be looking to tie in that cutter into the operation and then into the live portion of this event to potentially work with the FSM patrol boat that they will hopefully have back by that time. Next slide. For FSM Medical, next slide. Medical, it would be a scalable team, approximately 14 personnel, along with vet and vet tech. We will be looking to conduct this at Pohnpei State Hospital, and we would be looking to conduct several outreach events. Again, we've sent off the RFI to the local folks to see kind of what specifically FSM would be looking for if we were able to bring this team on island. Next slide, please. Next slide. So this is the sample of the medical team composition. They've actually ironed out the details, so we'll revise this slide now that we've got a better idea of what folks they'd like to bring. And then we'll also update the folks on the ground with the specifics of who we're bringing and then what capabilities I would offer to the local country, sir. Next slide. These could be concurrent with, and then finally, course topics they could additionally teach. Next slide. HNOE, kind of like we discussed earlier, we've put forward what we would like to do or what we can bring with the small 4 to 5 personnel on island, and we're waiting to hear back from the host nation with regards to outreach efforts we can conduct. Next slide. Highlighted here the 5 packs that could do both powered and acoustic events, and the kind of the events they would be looking to do. Next slide. So kind of our outstanding RFIs, 90 days until they are looking to address their policy. Kind of highlighted there is it's driven by the Guam and Palau numbers. Our additional RFI phased reopening plan. What will a reopening look like? Will 2 weeks? And then kind of the other highlight is will their ROM requirements vary between FSM states? Because it is a federation, sometimes YAP and Palawan have had different, Pohnpei have had different ROM requirements, which would have an impact of when we can get folks onto the island, sir. And then kind of highlighted, as we've discussed earlier, the specifics for medical training, location of HADR training, and then requests for HNOE and DB events. Next slide. Any questions, comments, concerns from the room? Sir. Hi, sir. Any additional questions? Thank you all for your time.
All right, we're going to bring up our Philippine team, so we'll just take a quick second to get them set up. Perfect timing for anybody in here. Head and water break, 5 minutes, please. Yeah, okay, in order to
All right. Oh, let's get your seat. You better hurry up. Buckle up. Awesome. Awesome. All right. Good morning, everyone. As Brennan introduced me, I'm Lieutenant Zach Koffel on the Philippines OIC. The only thing, no changes to this slide. The only thing I want to point out is an update to the quarantine requirements in the Philippines. So the BOQ is the overarching medical outreach for the entire country of the Philippines. Not military BOQ. So, yes, very different. Yes, Bureau of Quarantine. So, their quarantine requirement has changed recently to no quarantine in the Philippines, just a negative PCR within 48 hours of your departure. That being said, Palawan, so Puerto Princesa is where we'll be going, has an additional quarantine that they are still maintaining, which is a 7-day quarantine, and at the end of that allows personnel out on either the 5th, 6th, or 7th day with a negative antigen test. So we'll have further RFIs going forward on how we're going to work that with the city and the AFP. No changes. No changes. We'll stop here. So pending RFI. So the major RFI for our anchorage and berthing plan is if Mercy is going to be able to pull along pierside at the international port. So planning for that, the plan is to anchor out when we arrive in 24th of July for our set quarantine and execution date of 3 August. Morning of 3 August, we will come along pierside, offload personnel and equipment. The Mercy will go back out to anchor, where she will stay until the 16th of August. Once we hit the 16th of August, the plan is to bring the Mercy back along pierside to unload personnel and equipment, and then additionally plan for a closing ceremony, which we'll get to later in HNOE. Yes, sir. Absolutely, sir. For our recommended DV events, working with our AFP counterparts, we've identified 5 events, 2 of which being the opening and closing ceremonies. The AFP equivalent that is planning to attend, still working that piece, obviously, is an 09 equivalent. He is the Westcom commander, 3-star. And then for the next 3, we have a ribbon cutting ceremony for the multi-purpose building in Lisbon Minda that our engineering lead will cover. the tabletop exercise for HADR, and then also the execution of the FTX and SARX by HADR by the deputy commander, who is a 1-star. That's all I have. Engineering.
All right, let's cover engineering. Next slide. Okay, so for engineering, we're going to have a fly-in echelon mid-July to 11 August. 11 August will be when the ribbon cutting ceremony is. That will be for the new construction in Luz Vimenda for a multi-purpose facility. NMCB4 will be executing that construction with NMCB3 helping out as far as coordination because we already have members on island. And again, 20 personnel will be there to do that construction. As far as Advon team goes, we're not exactly planning on sending an Advon team since we already have NMCB3 on island, so we'll utilize them to the greatest extent possible. As far as sailing, we'll have ACBs, so Amphibious Construction Battalion, 20 personnel. They'll be coming in on the ship, and then they will be performing renovation efforts at 2 locations. Additionally, for dedication ceremonies, I mentioned on or about 11 August for Luz Vimenda construction. Renovation ceremony dates to be determined. And then we would all depart. So NMCB4 would remain on island after they finish their construction for tasking that they would be finishing for 30 NCR. And then the sail-in echelon would depart 17 August. Next slide. All right, so again, 3 construction locations. So Station 3 is the new construction at Luz Vimenda. Stations 4 and 5 are the locations for renovation efforts. Next slide. No changes to this side. This is the location for the new construction. So again, the current facility, extremely deteriorated. That's already been demoed by the Filipino, I guess, military forces. And we're going to utilize that area. Hopefully the concrete pad remains, and we can utilize that to start new construction. Again, as far as details for that construction, 20 CBs, 150K, 30-day duration. Next slide. And then additionally, what I want to mention is I say 20 CBs, but we'll be partnering with the Air Force. Oh, excuse me, that'll be Vietnam. I got mixed up there. Next slide. As far as renovation goes, at Salvacion, the office there will have a an ACB det out there to perform renovation work. This was prioritized by the Filipino captain. Next slide. No changes here. Next slide. And then additionally at Buena Vista, renovation work will be scheduled at this location. ACB det will perform this work, and they're coordinating that effort entirely via the sail-in echelon. Next slide. Just further details on this one, no change. Next slide. All right, so some consideration for all sites. So the wet season being July to October, we might impact that to a degree. Hopefully our schedule has enough float as far as the renovation work to mitigate that. I think we've got enough leeway since the NMCB det is there post-ship sailing out. We should be able to finish that construction no problem, even if the ship has to leave at a later date. Or excuse me, even if CB det has to leave at a later date. And then delivery of materials, we're coordinating that. We already have a BOM ready to go, or bill of material ready to go. So we just have to get with the contracting officer, make sure all of that gets ordered. Next slide. All right, HADR.
Good morning. Next slide. Okay, objectives for HADR. Exercise disaster response resiliency within the local government, enhance barangay post-disaster response capacity, develop first responder skills, maintain on target for international search and rescue accreditation, develop climate change GIS knowledge. Those were identified by the city government and the city disaster management office. I find kind of mesh well here and have helped us identify the objectives that we want to achieve. With regards to our assets, the Mercy, obviously, the Hawaii National Guard and the Philippines have a long-standing relationship, the city government, AFP Westcom, and the Philippine Coast Guard, and then the Department of Social Welfare and Development. External support. For the tabletop exercise, we've discussed reaching out to the ASEAN Humanitarian Association, to the observers, as well as the United Nations Office of Coordination for Humanitarian Affairs, the World Food Program for some of the training that we'd like to do, as well as some NGOs. Next. Next slide. Okay, so I mentioned some of the objectives earlier, and those objectives, because we're going to hit them later on, but this just sort of shows you how the actual things that we're trying to do, how they tie back to the objectives that we've identified with the local government. Next. Schedule. So there's a couple of things I'd like to draw your attention to. The first of which is the collapse structure training. So there's no trainer on the ground in Puerto Princesa for the collapse structure training for first responders that we've identified we'd like to do. That being said, we've looked into how we could construct one, and we've looked into the building materials, the plans for that. We've already started to receive some information on that from the AFP, and specifically from the previous Pacific Partnership that was in the Philippines. So that's going to take some time to set up, and theoretically that would happen in the first couple of days. The other thing that I'd like to draw your attention to is this mountain search and rescue training for barangay, and how that mirrors the days when the rest of our Pacific Partnership contingent will be in various barangays throughout Puerto Princesa. So you'll see this repeat throughout the schedule, and that lines up with the rest of our team. We also have subject matter expert exchange series that will be taking place, and those focus on the different types of classroom trainings that I mentioned earlier. Next slide. Okay, one of the big events specifically requested by the Disaster Management Office is this tabletop exercise. We anticipate that spanning the course of 2 days, kind of pulling from some of the lecture series items that we're going to hit, leading into the field exercise, which will be the culminating event of a lot of the work that we've been doing in the Philippines with regards to HADR. Of course, we're going to have an after-action review to evaluate how we did and how much, I guess, did we feel as if the time that we spent. Okay, the SME series. So, incident resilience, a lot of GIS training, and then this says camp managers. It should be camp management training and humanitarian supply. Next. Okay, we're going to go through the next few slides rather quickly because it's just more details on each of those classroom trainings. So just keep clicking and I'll tell you when to stop. Keep going. Okay, stop. Right here is good. Okay, collapse structure training event. So the personnel who are going to be involved in that, this was relayed to us from the city government, but fire department, AFP, police, the Coast Guard, and city level responders. That's who they'd like to participate in that. It'll be at the Joint Maritime Training Facility, which is a location that is going to be getting what seems to be a lot of work over the course of our time in the Philippines. It's a facility managed by the National Police, and so we know we want to do the tabletop exercise. What exactly the series of events that are going to unfold throughout that exercise look like. And this is what we'd like to have outside agencies come in for evaluation. Next. Field exercise. One aspect to this that I haven't mentioned is we'd like to do an aeromedical evacuation. So finding that helicopter LZ, whether that's at the Joint Maritime Training Facility or elsewhere, is something that that is an outstanding RFI, but something we're definitely going to be looking into and nailing down prior to the FPC. Next. Mountain Search and Rescue and the Barangays. Next slide. Maritime exercise, we're going to be working with the Coast Guard. Seems to be trending towards a mass rescue operation. But that being said, the Philippines has directly requested working towards international search and rescue accreditation. So something that lines up with that syllabus is also going to be a major consideration there. Next, Princesa, ensuring that it's safe following any sort of disaster where there could be something in the water that obscures vessel traffic, or obstructs vessel traffic, rather. Next slide. Okay, locations, we discussed these earlier in the week. I'm not going to go back through them. Go to the end, please. Okay, HNOE. Sir, do you have any questions?
Morning, sir. Lieutenant Shemetsky. I'll be bringing you the HNOE portion of the brief. Next slide. Overall schedule of events on the first two slides, they're going to be broken down as we go through the individual days, so I'll brief them there. Next slide. Next slide. Next slide. So the city has requested that they really do want the opening ceremony to occur on land. So we're looking at being able to do that in Mendoza Park. It's a city proper venue. It's probably one of the larger ones that we can be able to brief in. We'll be working with the protocol officer and PAO more closely to actually fine-tune timing and flow of this event before the FPC. Next slide. So Thursday, August 4th, the city has requested, because of the nature of our rural outreach with this mission, that they want to try to cluster as many events close together as possible, because numerous barangays are going to be combining together around the mini city halls for execution. Some of these members of the population literally walking over on foot. So they want to try to get as much together as we can. So every one of the mini city halls is going to follow basically a similar format. There will be a medical fair component that Medico will be briefing what that's going to be looking like. That's going to be an all-day event, all right? And then there's going to be an HNOE component of it on one of the 2 days. Local will be sharing space with that. So basically, with this as a model, NAPSN had requested a morning band concert. All the other ones are going to be in the evening. So this one, Medico's going to get there. They'll be occupying the covered gym. They're going to be able to get things going and do one of their mass trainings. They will be clearing them off. The band will be doing a concert. After the band completes its concert, they'll break their stuff down. Medico will reset up and continue their engagements, and I'll be shifting at a basketball game at some point for sharing the facility. And in some of these barangays, there's going to be close venues next to each other. For example, the high school is a quarter of a mile away from the youth center covered gym, so we'll probably be bouncing back and forth between them. The precise nature of where each of these events is going to be occurring will still be solidified by the FPC, but the fact that they'll be occurring around the same time is the same. Next slide. Next slide. The following day, on the HNOE side of the house, I will be returning to the NAPSN area early in the morning, and we are going to be doing one of our 3 planting projects that day. The city has requested that be an early morning planting because the local population is going to be coming out as well to be able to participate. They said the optimal time to be able to do that is between 7 and 10 o'clock. Return to the ship. Well, my component of the HNOE is doing that. The band will be remaining behind in the city proper. Next slide. Next slide. And they will be executing a indoor mall concert at Robinson Place Mall that evening. Next slide. Next slide. Saturday we'll be at the Baliong People's Park, which is a large both multi-sport complex and trying to think of it, kind of city center auditorium type thing. It's multifaceted, so we're going to be able to do a couple of different things. There is a water fountain area, dancing water display. Band concert will be occurring closer to that area. To the right-hand side of that, which we don't have a picture of, there's multiple basketball courts, soccer field, running track, stadium seating. So we'll be engaging for about 4 hours doing sports and activities, culminating with a band concert in the evening. You kind of see it a little bit more here between their covered auditorium, the dancing water display, and then the track. Next slide. Sunday, we'll be going up to the San Rafael area, and this is the one time where we sort of flopped it. Usually we'll have like the big medical fair event followed by some sort of a communal activity the next day. This one we had to swap because of the band schedule. So we'll actually be doing the Host Nation planting project on Sunday morning. Following Sunday morning, the planting project, I'm going to go ahead and try to conduct a worship service with anybody that cares to attend for there. Thinking Genesis 21 and Abraham went to Beersheba and planted a tamarisk tree would well that day. So we'll do that. I'm going to also be working with the Armed Forces of the Philippines. They have a Catholic chaplain that's stationed there at Westcom, and as long as he's able to partner with me, we'll be able to do both joint services that day on the beach where we did the planting project. I think it'll be a very good way to do it. If not, I'll be working with the Diocese of Jarl to be able to see if the local priest can come out from the parish and join us. Next slide. Next slide. The morning that I'm doing that planning project, that evening the band remains behind the city proper. They'll be conducting their next concert at the SM City Mall. The following day, we'll actually be holding the medical fair portion and joint portion here on that Monday. Same format. San Rafael's down by the beach, though, so we're going to be able to bring a few different site, or same theme, different site, Macaracas. The one barangay that did request some sort of a cleanup project, but the precise location for that is going to be determined at a later date. Next slide. Next slide. At the Luzminda Menging, Cristo, help me. Mengista. This is where the orphanage and the youth center is located for the multiple barangays. So rather than doing a planting project here, we're going to be engaging with them. So in the morning, we'll be over at the youth detention center. Medical is going to bring a contingency along on this mission as well, while some people are conducting the second part of the medical fair component in Luzminda proper. Another smaller delegation will be with me, and they'll be engaged at both of these two venues. Next slide. Next slide. And then the orphanage in the afternoon. Through the briefings over the course of this MPC, there was good dialogue back and forth between the JAG's office, myself, and others about the need to be able to bring some component of goodwill gesture here as we actually engage with the orphanage. So I'll be working with them to be able to do something that's appropriate within the limits of legal ease to be able to bring something to these children. Next slide. Next slide. Saturday, we're back in the city. So this is going to be the Mendoza Park City Library. I'll be working with the librarians and a handful of volunteers, because this is a smaller venue on the indoors, to be able to do some reading exchanges, both in Tagalog and in English. And then that'll culminate following the event right across the street from this library at Mendoza Park. Next slide. Next slide. With the larger of the band concerts back in the same venue that we had sort of begun in. Next slide. That takes us to Sunday. Sunday, we're looking to be able to exercise this scoop basurero, and this is the one spot where I definitely have an RFI where I'm going to need your input on as far as execution, sir. I'm looking, go back one. Looking, again, because this is a Sunday, looking to be able to do some sort of a mass and worship service before everything kicks off outdoors there at Baywalk Park in this area. And then we'll actually move into the execution of the event. Now, the scuba sorero, if we actually do it properly and do it as a full scuba sorero with propriety rights, involves putting divers in full suits into the water, scuba tanks. From the standpoint of water quality, water safety, that's the easiest way to be able to do it, because it eliminates all risk, no different than putting divers over the side here in San Diego. But it limits the amount of people that can actually be in the water. The city is very comfortable with the idea of everybody going into the water and just doing this with snorkels and with diving masks, because the average depth of the harbor is about 5 feet. Main thing is just going to be, is there any, what is the inherent risk that sorry, not 5 feet, 5 meters. What risk assessment is there as far as water quality or anything like that? The peninsula, the reality is the harbor side is the side we're going to be in on, and just on the other side of the peninsula are like city beaches. All right, so it's close from a water standpoint, but we'll still need and have as a due out from the MPC for the FPC a water quality assessment of the Port of Princessa Bay Harbor to be actually make a determination if we want to actually have snorkeling in that water. If we don't want to do that, we are looking to have a surface element of this anyway, with relay races back and forth between the Armed Forces of the Philippines, local population, and the U.S. Navy personnel on the surface. They've got a larger role, and we'll nix the water. City halls, except this one is going to just be at an individual barangay level. There's next slide. That takes us to our closing ceremony. The closing ceremony is anticipated to be on board Mercy, whether we're pierside, whether we're at anchor. That detail, it still is to be determined, and we'll be working with the protocol officer and PAO on that. Next slide. That's all I have, sir. Are there any questions? Good, sir.
Morning, Commodore. Morning, everyone. So for medical, the big changes on this slide from the first time we talked about medical is that we've solidified a few more partner nation assets that are going to be working alongside us. We've got the Australian Medical Forces who will be sending a contingent of providers to work and insert alongside us. And I've also heard rumor about Malaysia coming to the table. I don't have much details yet on what type of providers they are yet. But as we build our scope of events, the plan is to share that with them and then let them have input on where they think their skills would be best served. I'd like to push them to the front so that they get FaceTime or airtime out in the public events rather than stashing them on the Mercy with what we're doing there. And next. So during this MPC, actually just a couple days ago, we got some more solid input from the LGU on where they, now that we have commitment on where they want us to be performing or our engagements, we're able to start getting more into the nitty-gritty about how these events are going to go down. But in the spirit of really making this a partnership and us wanting them to own the product, there's still a lot that has to come from them as far as where these events are going to fall. So even though I have a breakdown for you of what we think of the day-by-day will look like, it's still going to change depending on what our partners want to receive and when, and where they want us to deliver. But this now there are 4 locations that are mini city halls, as Chaps was saying. The LGU has identified 4 mini city halls and 3 barangay covered gyms. They sent us a very elegant breakdown of how they clustered their populations around each of those locations. So each of those sites captures anywhere between 5 and 12,000 citizens. And so, like Chaps was saying, they really want us to focus all of our efforts in the 2 or 1 days that we're at each of those sites, because people will be walking. You see this mountain range up here in the north. Some people, like the indigenous peoples, live on the other side of those mountain ranges, and they have to walk 6 to 10 kilometers by foot over the mountains to get to where things happen. So it's going to be a big deal. Next, please. Just a recap of medical sites. This will still pending another final update now that we have more official sites. Next. All right, next. So we're still working through the JMD process, but we're getting closer to a final on what the Mercy crew is going to look like. This is just a snapshot of that. To add to the vet medicine, we'll have the 2 veterinarians. The vet medicine are the Army assets that we'll be bringing with us. 2 vets, 4 vet techs, and 2 food inspectors. Next. And then we're also working through the details on some fly-ins, just because of staffing and manning constraints back home. Some specialties will need to be brought in specifically for the engagement in the Philippines and then sent home rather than going on the full float. Here's a capture of what our Australian partners have fed to us that they're going to be sending. I'm still pending Malaysia. more the merrier. Just to recap, same slide from earlier in the week. Our partners on the ground still having lots of conversations. The NGOs are drilling down on where they're going to be inserting alongside us to provide education. I'm excited about that. Next. Just an overall capture as far as the movements. That map needs to be updated because that's from an old Pacific Partnership. But here we've got basically between the 3rd of August and the 16th of August is when we're going to be doing the majority of our events, and then the 15th or 17th departing. What you're going to see in medical training, the first phase, nursing student or the nursing colleges have offered to have their students give a brief to Mercy personnel on, it's basically an introduction to the Philippines, culture of healthcare, what you need to know as you're interacting with people here. Working through the details on where that would be, I think maybe the Mercy, if we can figure out the logistics. If the ship is pierside, that might make it easier to just bring some of them on board and catch as much of the crew as we can. That's all right. And then having nursing students capture some clinical hours whenever we start doing patient care on board. And then the veterinary engagements that are going to be working alongside the city vet. So you're going to see a lot of those repeating, those SME engagements. Next slide. All right, here's where we start our big barangay community health fairs. And then co-located with that is going to be health worker training and education that's focused on those healthcare providers that are practicing out there alone and unafraid. Another thing, as we click through, you're going to see BLS. One of the big asks from our partners was helping them update their certification in BLS. Last night, I spoke to one of the individuals. There are 3 people on the entire island that are qualified to issue certifications for BLS through the Department of Health. The Philippine Department of Health owns that. And so they're in the process of exploring and negotiating how we can help them deliver classes, because there's a student to instructor ratio, how we can help them deliver classes that will still allow people that attend to get an official certificate. Over the last 2 years, this is one of those things that has been completely suspended due to gatherings, and so a lot of physicians and nurses are about to expire, and that jeopardizes. That also dovetails into one of the primary asks, is that they need help with BLS mannequins. There are only a couple of assets there that have a very small amount of mannequins, and so one of our RFIs navigating through this is to see if there's a way that we can get mannequins to use during training and then somehow leave them behind. But I don't know how that's going to materialize. Other things you're going to see are the Palawan Smile project that I mentioned on Monday. That one's a local-led initiative that our surgical planner is looking to help get off the ground towards the cleft palate cleft palate and lip repairs. And then other, general surgery procedures and pediatric surgery procedures that we will find out more detail on as the medical society works with the LGU to pre-screen appropriate candidates. You can go through these. Another thing to highlight at our barangay events, we're going to have an opportunity for physicians to engage with individuals that just want to be seen, want to have their vitals. And this was one of those that I was a bit more reticent to commit to because we're trying to trend away from direct care, but the LGU particularly asked because a lot of these people live so far from the city that they go years, some of them have never even seen a doctor. And so part of the value of seeing the Mercy and U.S. forces there, and then us bringing the AFP alongside, and then them seeing their local doctors is just to bring us there and let these people have an opportunity to talk to a doctor, have their vitals taken, and basically be told they're okay. And then the other thing that we have to figure out is that if we do identify an issue, how do we refer that through the health center to care? So we're not just saying, yeah, you should get that looked at. Bye. Yeah. All right, next slide. We're just going to move through these. Some of the other things you're going to see are the PrevMed, water, sanitation, hygiene, Our EHO was working with the LGU to get them education on that, since they've asked for a lot of their sanitation workers are volunteers. So just to give them sort of a plus up. And then we talked about Operation Tule. So a lot of these things are going to be happening at the same times at the barangays, but we are going to be staggering Operation Tule, just because if the kids want to engage in the festivities, we're trying to do Operation Tule after we've had the barangay event and then come back. AFP, we've had some really great discussions about what they're going to be able to bring in, and we're projecting somewhere in the neighborhood of 100 circumcisions a day, depending on, I think the LGU said by March they'll be able to get me a better idea of how many people in each of those areas are going to be asking for that service, and then we can scale up or down depending. All right, I think that's it. Just this is just a snapshot of the schedule of events. And then to recap for the medevac, which we discussed briefly on Monday, there is the intention is if somebody gets injured, but it's not immediately life-threatening, the goal is to get them to the Mercy. If they are not stable to the point where they need something more immediate, Adventist Hospital in town is a level 2 and seems to have the best level of capability. And we met with them while I was there and discussed this, and they're more than happy to receive our personnel. And then from there, they said it's not unusual. They've seen it happen plenty of times where they've had to arrange medevac to St. Luke's, which is a higher level of care in Manila. And then I'm going to let Lieutenant Koffel take the RFIs.
All right, thank you, Crystal. Yeah, so we have a list of the medical RFIs here. If you want to go to the next slide. And then just overall RFIs is kind of a mix. I'm working on organizing that, covering it in an Excel document. We're checking the RFIs and then also the answers. That got a little jacked up. But other than that, are there any questions or comments? Okay, at this time, I'd like to invite Colonel Mampuzzi up to the stage. I only had one hand I couldn't clap.
Good morning to everybody. Commodore Kim, good morning, sir. And to our partners, Australia and Japan, and those who are coming to the Philippines, this coming Pacific Partnership 2022. Again, sir, thank you very much for inviting us. Commander Bobich for bringing us here. Thank you very much. We hope to bring the Puerto Princesa local government this coming March in the final planning conference so that we can solidify their commitment to our execution of Pacific Partnership 2022. And again, sir, I would like to thank years in the PACOM and PACLEAD for bringing us here. We share a lot of history together. We have been shoulder to shoulder for quite some time now. I can say that I have worked with a few of you personnel. Of course, Laureen Shelton has been, of course, bringing us here as well. Thank you very much, sir. Thank you very much, Commodore. And we would just like to highlight our appreciation and our commitment to the execution of Pacific Partnership 2022. We will see you there in the Philippines. Thank you very much and good morning.
Thank you, sir.
Okay, finally, we're going to bring up our Vietnam planning team.
Hey everyone. Just one quick public service reminder. We do have the sign-in data sheets. It's been over here for a few days. I think they're about like half filled out right now. So I do ask, if your name's not identified on there, please go ahead and write in. And we're just looking for points of contact. So name, email, what command you're representing, any other notes that are noteworthy for the group. We will consolidate that list, digitize it, and we'll get it out to the masses as well. So if you haven't signed in yet, please do so. Thank you.
Another quick note while we get set up. In regards to the final planning conference, again, that is going to be the 21st through the 25th of March. As far as the venue, we had originally looked into doing it here. It looks like it's going to be a better fit for us to do it at another venue. That's still in contracting right now, but for those, we will get that information out to you as soon as practical. And if you have information on who you might be sending, we can start getting some preliminary head counts. That would help as well. All right, we're going to bring up Chief Warrant Officer Victoria Snyder as our Vietnam OIC.
Right, good morning, everybody, again. This time you'll have a lot less talking from me and a whole lot more from the team as they go into specific details. Overall, there's very few changes. Oh, thanks. I'm so hurt right now. There's very few changes to the overall movements that have been taking place. However, over the course of the week, we've added quite a bit of data to the various points, and you'll see those as we go through. There's been no change in the overall movement in Vietnam. Next slide, please. However, this is the basic breakdown of how people are going to be getting there, when we expect them to leave. So first and foremost, keep in mind the flight in schedule right now is limited based off availability. So currently, the arrival to Hanoi with the engineering team is set for 6 May. That means that by the time they can get to Phu Yen, it's about 4 days later, so we expect them in Phu Yen by the 10th, which means that they can start actually working on the 11th, unless they really want to push it on the 10th. ADVON team will arrive in Hanoi on the 3rd of June, followed by the transit down by the 7th of June. That includes the partner nations as well, since they would be on the same travel schedule. Mercy would arrive to Cam Ranh Bay on the 6th of June. We are requesting, hence the asterisk, that we can do the onboard surgical care while we're still Pierside down in Cam Ranh Bay, which would start essentially the 13th, which would give us the 1 week of Pierside. Nobody's coming on and off COVID restrictions, but again, that has not been approved. So the idea is by the time we leave Guam and we're Pierside on the 13th, that will be 2 weeks of essentially a bubble. If it's a 14-day restriction, that would cover 14 days. But we have to get Vietnam to agree that departure from Guam starts the bubble, and the 13th would then end the 2 days, or 2 weeks. Hader team will arrive in Phu Yen on the 19th of June. They will be engaged in the DEA operations in Hanoi on the 20th. And again, that is subject to restrictions, with the first event starting on the 21st. And then all Pacific Partnership members, whether they're sailing on Mercy on the 4th of July or they're flying out pending flight availability, will be departing as of the 4th of July. The notable exception would be the engineering team based off of when they need to leave in order to get to their next project. No, sir. So they would arrive in, as long as nothing changes, they allow us to do the quarantine for 3 days in Hanoi, and then we have a quote-unquote working quarantine down in Phu Yen. So by the time we are on the flight to Phu Yen, they have had passed 3 negative COVID tests. So Vietnam considers that good enough. So they allowed us to fly from to Phu Yen and immediately start working. So the national requirement for quarantine, everybody who's doing travel between the different districts or provinces, they have to download an app on their phone to allow for Vietnam to track the various personnel. And basically you have to show that you have a negative COVID test as well as current positive health, and that's their one requirement. But you have to have a negative COVID test within 3 days of arrival, not departure, as well as a negative test upon arrival, and a negative test within 3 days of being in the country. Those are your 3 test requirements in order to basically have fair movement within the country. You have 3 days
of quarantine where they take you post-arrival COVID test to your hotel. You're given a paper that says, I will not leave the hotel, subject to fine and imprisonment. And it's in Vietnamese, which makes it very scary. Which you have to sign. You stay in your room, and you cannot leave until they give you a negative COVID test on the third day. We don't know yet, sir. So ideally, right now it's set for 14 days upon arrival, that is because we're going with worst case scenario. The 14 days is based off of the scheme of maneuver that was established back in October before things got reduced down. So in order to prevent us from opening up our schedule and then losing that time, we have gone with worst case scenario, COVID based. The latest we could possibly enter, as long as nothing changes, is the 21st of June as the first event. So arrival on the 20th, get all set up, anchored out, first event on the 21st. If they relax the requirements, that means that we can start operating after 1 week as of the 13th. If they relax it even further and they let us do events upon arrival, because that will be 7 days underway in a bubble, then that would be the 6th. However, there's indications that if we were to expect that, we would have to do a full test of the crew, which is the requirement for anybody who does air travel, and that would be a bit too intensive based on the volume of personnel on board. Which means that we would have to start upon departure from Guam, and the current Mercy infrastructure allows for 2 tests every 45 minutes without having to do a repeat. Perfect. Then that will give us further justification for allow for earlier arrival and operations within Vietnam, but right now we just don't have those permissions yet. Sure. There's been no changes to the overall site infrastructure. The Vung Ro Bay, which is where we'd be anchored out, and the Cam Ranh Naval Base, where we would be able to go pier side. Yes, sir. Yep. This is the proposed comms and watch plan for the Vietnam stop. Overall, the primary communication would be through duty cell phones that would be issued to leadership, OICs, and LOE leads, as well as SIM cards issued to all other personnel that require them. Secondary would be Wi-Fi hotspots that are issued again to leadership, OICs, and LOE leads, with additional redundancy units available for each site to ensure that we have double coverage at each event. A command center will be maintained at the Alba Rosa Resort, as long as that's this resort that goes under contract, which is where the Advon team will be staying. Ultimately, there will be a 3-person minimum watch team for 24-hour coverage in order to liaise between DOFA as well as the mission commander and senior leadership. This watch will be required to maintain the quad slides as well as monitor the movements throughout the day to ensure departure, arrival, and return are all properly maintained for each event. This is going to be the level of care and medevac requirements as we go through. For primary level of care, there will be a Garmin available for each event site. For level 2, the recommendation is Fuyin General based on availability and proficiency. Any level 3 will have to be gone into 25-hour flight. We will update that, sir. And I'll now pass it over to the engineering team.
Yeah. I'm going to use it for my slide. Next slide. So we have 2 projects for Vietnam, one at Lam Sam, one at Phu Khao, 2 schools. So for the fly-in echelon, we'll be arriving, or we'll be on site 12 May, arriving on the 6 May flight, and construction will begin anticipating 1. For sail-in echelon, so sail-in dates 04 May to 4 July. ACB1 will be on board. We're currently looking for renovation projects, reaching out to the country OIC to reach out to contacts in Vietnam, looking for future work for ACB. Dedication ceremonies, so we anticipate construction completion for both facilities 20 June. So that's what we're looking as far as a ribbon cutting date for you all. And then departure dates, so sail-in echelon to depart on 4 July with the Mercy. Fly-in echelon with NMCB3 and Air Force personnel to depart day after ribbon cutting ceremony. Next slide. All right, so these are the 2 NCAP locations. As far as Lam San distance goes, 21 kilometers, commute approximately 30 minutes to get to site. Phu Khao, this is the more difficult one to transit to. Longer distance, much longer commute, 70 minutes. We'll have to work that into our schedule when we're planning our concept of operations at the CB level to determine how much time we can really spend on site. And as far as lodging, might have to possibly see if we can lodge closer to the construction site. Next slide. So for Lam Sam Primary School, no changes here. Again, it'll be a combination of NMCB3 personnel with Air Force personnel, 30-day estimated construction time. Due to the fact that we have to coordinate, we've built in a little bit of, it's going to take a little bit longer than that 30-day window, but we have that time. Next slide. No changes here, just additional info on the site. Next slide. So with the Phu Khao School, again, we're going to be using 10 personnel from NMCB, 10 personnel from U.S. Air Force. We'll stick with that combination. One thing I do want to mention is we're going to coordinate for project management to transit between the sites. That'll just basically guarantee that we do have project management covering both locations, and it's a little bit more uniform. What they're seeing on one site might apply to the other, and so it just allows for reduced need to communicate between sites. You've got project management for both locations. Next slide. All right, no changes here. Do want to mention the flood line. I know I said this a couple times. This will be something that we have to discuss with the NAVFAC engineer to make sure that the current design accounts for raising the project site at 2 feet so it does not flood during the wet season. Next slide. So again, considerations for all sites. The wet season, that's something that we'll need to account for at that Phu Khao site. Lam San, I'm still digging into that to see if we do need to account for that there. UXO screening at the Lam San, and we are reaching out to see if we need to do UXO screening at Phu Khao as well. So more to follow on that one. And then additionally, since we are working around areas where children are playing, we want to make sure that the job site is roped off so no incidents occur on site. Each project will have site safety assigned, though, so they would be in charge of that, and we'll have a whole safety plan developed for each project. Next slide. Additional info on some admin and logistics. Class 1, so flying echelon would receive proportional meal rate, so they would be responsible for their own food. Sailing echelon, breakfast done on the Mercy, possibly MREs on site. Then for Class 2, we're planning on wearing our uniform, NW Type 3s. It's typically what we're doing when we're performing construction in country. For Class 3, we're coordinating that through the contracting team. Yes. Really? So are you all providing those polo shirts, or do we need to contract that out? Okay. So they must be long sleeve. I will state that. We cannot wear short sleeves out on site. So we could wear something underneath, so that's fine too. And that's fine. We can throw frog gear on. We do. Yes, sir. Perfectly fine. We'll just throw those on top. Yes. Right. Perfect. As far as pants, though, I mean, that's just these as well? Okay, perfect. Okay, so we'll make the changes on that one for Class 4, so construction materials, coordinating that with the FLC team. And then additionally, since it's a 90-day lead time, actually that day is today that we would need to order material. But a more realistic date is, mid-March timeframe is when that material would be ordered. Had a lot of conversations with Matt this week from supply. And then medical, they already discussed that on a previous slide. Next slide. A few moment. Okay. Thanks, sir.
Good morning, everybody. I'm moving really closely with the Oregon National Guard. This is going to focus really on ICS and search and rescue on the water for our portion. Incident command system. So we're going to be focusing on the very basics at this local level. It's going to be ICS 100 through 300. This is going to be the Pacific Partnership portion is going to be following the DMEA engagement that they're going to have in Hanoi, where it's going to be at a larger level. So the first few days are going to be a review of ICS 100 to 300, and then we're going to be doing ICS 400, which is more of the command staff and decision making at that point. That's going to be up in Hanoi. And then after that, we're going to do a TTX in Hanoi. Same exact sequence of events that we're going to be doing in Fuyen, except we're not going to be really focusing at 400. That's a higher level. Our assets are going to be the Civil Affairs team, Oregon National Guard, and us. And we're also going to be working at some point with the Center for Excellence. At the end of this, so we're going to be doing the TTX, subject matter exchange, and culminating everything with a full-scale exercise. Yeah. Thank you.
Morning, Commodore. I'm Senior Chief Conover, and I'll be briefing you on HNOE events for Vietnam. Real quick, the Pacific Fleet Band out of Honolulu will be providing 2 ensembles for the total Pacific Partnership. On board the Mercy, you will have the top 40 group, which is all the equipment and the big group. For FSM and RMI, there will be a flying echelon on standby in Honolulu that will be supporting those 2 host nations. Also, and that will be a brass quintet, 5-person personnel. On both groups, on board the Mercy, partner nation support will be provided by Japan. You will have 2 Japanese musicians that will be in Vietnam and Palau. In RMI and FSM, partner nation support will include Australian Navy musicians. So Australian support in Oceania and Japanese support for Mercy engagements, Vietnam, Palau. Yes? No, sir. RMI and FSM will be fly-in echelon, and Australian musicians are on standby for that as well. So we have our brass quintet that is on standby for RMI and FSM, and the Australian musicians are awaiting word as well for FSM and RMI as well. Any questions on that, sir? Great. Just wanted to go ahead and brief you on that before we get started on this. So this is for our Vietnam. So I wanted to, for this particular 2 slides, I wanted to take your attention to the top and the next slide on the bottom. We'll start with the top. Transport of band equipment has 2 plans. If we are in Cam Ranh Bay and are able to go pure side, we will offload the band equipment there. 3-hour drive up to Vung Ro Bay, and we will stow it there on the truck, lockable with a watch until the Mercy is anchored out. If we are not able to use Cam Ranh Bay, then we will we intend hopefully to be able to use the tender anchored out in Vung Ro Bay to the pier as well. So those are our 2 scenarios. So Vung Ro Bay. Go ahead and go to the bottom, or next slide, please. At the end of the mission stop, there are 2 scenarios, and it's based on mission commander's preference. The closing ceremony can either be held on board Mercy or ashore. If it is held on board Mercy, our return equipment to Mercy would occur on the 2nd, and if the closing ceremony is ashore, then we would have, and the closing ceremony, on board Mercy would be on the 3rd, and if your intent is to have it on the ashore, then Pac Fleet Band would support and then transport equipment on the 3rd. Next slide, please. Sounded convoluted, I apologize. These are the list of engagements all the way from Song Khao District at the top, and our beach event further in the south on the lowest point. Next slide. All right, so opening ceremony. Next slide, please. All right, opening ceremony. This is one of their popular monuments. It's right there on the beach. The unusual shape, is actually in the formation of a particular rock formation that is at one of their beaches in the south, and it mimics that. It's a very large area, capable of supporting quite a bit of guests. Plan is 1,400 band arrival, set up and sound check, and 1615 key personnel arrive, welcoming remarks, concert at 1700. Now the concert may be 2 songs long or longer, because Pac Fleet Band will be performing with Sao Bien, which is a state-sponsored Vietnamese group ensemble, and we will be doing a dual performance, performing at the same time 2 Vietnamese popular songs. So that will be a big performance there. How long it is, we'll discuss that, and it's also based on how long your opening ceremony is going to be and how long you want it. But we can adjust from there. And of course, this is a rough sketch of what I've seen these things usually be, but ultimately, protocol officer would schedule those DVs and times. Next slide, please. June 22nd event is Nguyen Trung University of Civil Engineering. Next slide, please. All right, it is going to encompass a sports day with the chaplain team, and incidentally, HNOE consists of chaplain team and the band. So we'll have a sports day first, 15:30 16:50, followed by a performance by Pac Fleet Band, 1800 to 1900. We have 2 venues that are possible. This is the inside of this building, so we can go inside, and it is directly next to. Next slide, please. North Songkhao Park cleanups that we're going to be scheduling, and the amount of time that we're talking about, 1400 to 1645. Very doable to clean that area up. And the 1700 concert would be with all, of course, for the beach cleanup personnel, which Host Nation will be providing personnel as well on the beach cleanup, and the people of the town that would be advertised to. Next slide, please. Concert at April 1st Square, April 1st, 1970. You had asked about that date. It was an offensive from North Vietnam during the Vietnam War. It was held as a victory of the North Vietnamese. Next slide, please. This will be band only, not including the chaplain team. Band arrived 1600, set up and sound check, 1900 concert. 1900 for these evening concerts are the recommended times from Host Nation, where they believe that you'll get the most foot traffic. Next slide, please. Concert at Kong Vien Thanh Thieu Nguyen Youth Park. It is a park dedicated to young folks in the area. Next slide, please. Same situation, band only, not including the the chaplain team. 1600 band arrives for setup and sound check. Again, 1900 concert. Next slide. Vung Lam Beach Cleanup. This is the second beach cleanup that we're scheduling. Next slide. This event will not include the band, but we have scheduled it for 2 days, 25th and the 26th. 0900 to 1400. Of course, we can play with that time. However, there's a 2-day plan. Recommendation is to pick, if it is 2 days, to pick a realistic amount of area because it's a very large area that Vung Lam Beach includes. So pick a reliable area and clean it up, make it look great. There is additional time that we could dedicate to this beach. However, leaving that open days for chaplain to be able to schedule additional events with orphanages, maybe schools. I wanted to leave that open because chaplain was not able to attend this. So leaving some extra days to be able to spread the wealth, that's what I would like to recommend. Next slide. Songkhao Stadium. Next slide, please. Another soccer match followed by a band performance. For all of these soccer matches and sporting day events, we have discussed with Vietnamese Department of Foreign Affairs, making sure that they clean up the area, making sure it's presentable. Most of these venues have not been used due to COVID, so it's definitely been over a year since anything's been there. Grass is very long, so we've coordinated with Department of Foreign Affairs, Vietnam, to be able to clean up the area and make it presentable. Next slide, please. Sports Center of Tian District. Next slide. Same situation, 16:30, 17:30 soccer game, followed by a performance from Pac Fleet Band. Next slide, please. And this, hard for me to pronounce, Luong Van Chan. I hope I didn't butcher that. High school translates to high school for talented kids, so high school for gifted kids. Next slide, please. And this is the venue. They're requesting soccer and volleyball, soccer. And this is the venue in front of the school where we would set up the stage. Pac Fleet Band has played there before, and they're very excited to have us back. And that is the location that we normally play, is right in front of the school. Next slide, please. 3rd of March Square. 3rd of March is the commemoration of the end of the Tet Offensive. And this is 3rd of March Square. Our intention is to have a volleyball game. That was what was requested from the POC. And concert at Kong Vien Hong Square. Next slide, please. This will be a band-only event. 1600 band arrives for setup and sound check. 1900 concert. Again, another square, and this is more in the city, not on the beach area. Next slide, please. And closing ceremony, as discussed, it's going to be based on your preference, sir. Pros and cons. On the Mercy, you have more control as to what you're able to provide, and ashore, perhaps you can invite certain DVs that otherwise wouldn't be able to make it. So those are the pros of each choice. Next slide, please. There's your Mercy. Next slide. Any questions, sir? All right, thank you, sir. Appreciate it.
All right, good morning again, sir. I'm going to be brief in the medical portion of this. Much bigger footprint in Vietnam, as we have the Mercy and our full contingency of medical staff, as well as Vietnam fly-in staff, so quite a large group. We also have partner nation involvement. We have a significant number of staff who will be coming from Australia, as well as from Japan, to help augment some of our events. Various events including medical outreach and training, workshops, as well as surgery on board the Mercy. District, and that is right there with that little red box. You can see it blown up there. Most of the major medical centers are within a very short distance from each other, and then there are a few outlying health centers, particularly Song Shao way up at the top, and then Don Swan that are the way. Dong Swan is as far or on as treacherous roads to get to events. Next slide, please. These are the distances and times travel to the various events. The most could take a little over an hour and a half to get to. This is our Advon team. Lots of people. Lots of knowledge. This is our U.S. medical team component. As you can see, it's very large, very diverse. Doctors, nurses, surgeons, lots of subspecialists to meet the requests of the host nation, as well as ancillary providers, pharmacy, dietitian, nurses, and we also have civilian medical support who have been identified, that is pending approval, and we hope to utilize him because of his specific skill set. Next slide. This is our partner nation component, broken down a little bit more. Australia is providing quite a few nurses, medical technicians, as well as a dive medicine doc and dental components. And Japan will be sending a hematologist as well as a nurse. Next slide. So, assuming that the Mercy will be pierside in Cam Ranh Bay, we have the potential of being able to begin surgeries a little bit early. So this week, the 13th through the 19th, would be on ship events only. And the numbers for that are still to be determined. Next slide. The bulk of our medical mission will start on the 21st of June. And most of it will be in the major medical centers, as well as some events at the Tui An Health Center. And we have a very large footprint, so doing the calculations so far, that is 92 personnel ashore for that day, and estimated 250 various participants, including some patients. The number is so large for this day because day one is our surgical screening day. That's a major evolution where we are essentially running a clinic for a day so that we can lay eyes on all of the potential surgical patients and do one last screening and make sure that they are, well enough and appropriate enough to bring onto the ship. And so that is a significant event. It's at least 30 medical personnel and a lot of translators. So that's one of our big events. Next slide. On the 22nd, I'm not going to go through each of these events because we have so many of them. Just going to give you some highlights. But on this day, we are doing a community health fair that is for the Fu Yen Medical College, the faculty and the students there. It's kind of a preparation event so that we can hold the public event the following day. And so we're going to do a lot of education and kind of ironing out the topics and the materials to be presented to the public. So that's our major event for that day. Next slide. The 23rd is our actual community health fair, and we're hoping to have significant participation for that. There's a lot of interest from the Department of Health in holding that. During this time, we are also having various surgical engagements on the ship, as well as side-by-sides in our medical centers. They've requested like 50 joint replacements for knees and hips. It's a very large number to get done within the time frame that the Mercy is there. So we are proposing that our ortho joint team fly in with our medical Advon team so they can start those cases about a week sooner so that we can get through the caseload. So that's one option that we are looking at. Next slide. Friday, June 24th, continued events, continued surgeries. This is kind of the midpoint of the mission. This is where everybody is up and running. Next slide. Next slide. The 25th and 26th, we do not have any events on shore, as that is Saturday and Sunday, and most of the clinics will be closed, and so all the medical events will be happening on the ship. We'll have continued surgeries happening throughout the weekend. Next slide. All right, so the following week, we have even more events. We have a lot of partnerships with the Center for Disease Control, especially involving disease identification, COVID, and diseases such as malaria and dengue, which are pretty prevalent there. Next slide. All right, continued events here. We have a lot of women's health focus during this week, so a lot on obstetric emergencies and prenatal care. That was a very specific request. That kind of goes along with the Women, Peace, and Security initiatives that we are going with. And we also have a disease outbreak tabletop, which is a 2-day event where we are sharing information on various diseases such as COVID or malaria, and talking about those diseases at a scientific level and looking at population health and mitigation purposes. Next slide. All right. More events of note. We have a stroke continuum of care. Stroke is a very common health problem in Vietnam. It came up at multiple sites, and various sites asked for different things. Some wanted to know about how do you identify stroke. Some wanted to know about how do you take care of stroke patients. Others wanted to know, what do we do with stroke patients once they get home? So we've designed a stroke continuum of care symposium that will address everything from identification of stroke symptoms all the way through rehabilitation. Next slide. All right, more classes. One to note here is helping babies. This is not the same as our midwives here in the States, and they really want to improve their skills to improve outcomes babies that are born in those rural areas. So, all day, it is a little bit light on the number of events, but one event of note is our post-op clinic. So our doctors want to be able to lay eyes on all of the post-operative patients, make sure everything is good, that there's no further complications, and if there are any additional issues going on with the patients, we can have a warm handoff with their medical providers, and they can continue with their follow-up care. And next slide. This is a list of all the awesome things that we are bringing. And we do have a small veterinary footprint here. There was not much interest in animal type care, but they do have interest in food hygiene, food safety, as well as rabies and zoonotic type diseases. So we are able to incorporate our veterinary staff with their diverse skill set. Next slide. These are the various symposia and workshops that we will be doing. There's a lot of requests for nursing related topics, as well as mass casualty type situations. And we were going to do the event in conjunction with HADR and do this big mass casualty thing. That has been revised. So that is more of a smaller event to be held at the emergency department so that they can get practice with receiving multiple, and we're talking maybe only 4 or 5 trauma patients, and how to triage them in their emergency department. So it's not going to be a big evolution as we had initially planned, but the emergency room staff will still get training on appropriate casualty receiving and triage. We also have various public health related topics and the complex medical issues, which I already talked about, the stroke care continuum. But we also have a tropical medicine symposium, because we are going to an area where they see a lot of tropical or vector-borne diseases that we typically don't see. And we have a tropical medicine course that we can help provide information on. So it's a great back and forth between our Pacific Partnership staff as well as the Vietnam medical staff to learn from each other about tropical medicines. Next slide. These are the various courses that we're offering. The most common courses were life support or life-sustaining courses, which have a really high yield, very, very important. Similar to the Philippines, there was a request to have mannequins be left with these various health centers so that they can continue with their training. This is great for training. Next slide. RFIs. Were there any questions, medical related? Yes, sir. That's a very good question. Yeah. Yeah, there's typically an embarkation plan for any medical needs for any of the staff embarking on the ship, to include any medications or shots that are required for mission. Did you have anything to add, DMOP? Okay, perfect. Any other questions? By the end of or during the FPX, we'll have any finalizations to make sure everybody's on the same page as to the requirements. By the final planning conference, we'll have established what the embarkation plan is, and we'll have that approved during the FPX in order to provide it to everybody. But because they are already forward deployed for the vast majority, they would already have a lot of these requirements met. We'll make sure by looping them in, make sure nothing gets left off. But this is something that we already have a baseline understanding of what's required, but we'll streamline how this is going to be done procedurally, whether it's an individual takes care of it at their home command, or if it's something that we can take care of here prior to departure. So it would be an overall Pacific partnership with the requirements that are country specific, such as malaria, included to make sure that we have all the different wickets, but it would be a deployment specific embarkation plan, sir. It would be at our level, yes, sir. Uniform requirements, come up over the course of this week to a roadblock for. So ongoing pressure to increase positive outcomes in the near term. The finalization of the manning document, the scheme of maneuver to make sure we are tracking how people are getting in and out and when we can expect everyone. The materials that are going to be presented all need to be provided to the embassy in advance in order to allow for translation time, as well as for production time. The meal and water consumption plans for all events, especially the ones that have a requirement to carry over during lunch. And then, of course, all of the purchase orders, memorabilia, and the reporting requirements during mission execution for formatting. And then finally, the Liberty Plan and potential for overnight Liberty. That is an ongoing question of what exactly is going to be authorized. This is, in some regard, limited based off of COVID, but also if overnight Liberty will be authorized, that is going to be an ongoing conversation as we continue this planning. Next slide. Some of the partner RFIs, a lot of it's going to be the same with what is going to be the manning when people can be expected to come and go, so that we can all be on the same page. We don't want to have people at multiple hotels where it makes coordination difficult. Material presentation, for example, for the Japanese contingent, there's a number of products that would be beneficial for the community health fair, so making sure that we get those properly supported. Base restrictions when it comes to the coordination piece. Some of the Vietnam-based questions based off of who can answer at ODC, DOFA, or Ministry of Health. A lot of these are baseline requirements, such as the uniform requirements, what is going to be authorized in country, and to what level, as well as what DVs, VIPs,
and guest speakers can be expected at the various events. That way we can plan for proper coordination. And then there are some questions about the medical restrictions for bringing different prescriptions into the country based off of the Vietnam-based restrictions. This is particularly important on the dental side based off of the specific formula they want to use in order to provide the training. Next slide. Some of the engineering RFIs is able to do during the sailing portion. Next slide. Hater level events, overall manning, materials, and planning, and then any of the Vietnam level of participation to the various events, getting an idea of who exactly is going to be involved. Next slide. HNOE, the conversation on donations. That way it is not a we purchase it and cannot use it. So the donation piece, as well as the integration with the Japanese musicians. And that's already being discussed if it's going to be prior to arrival, if it's going to be a trip to Honolulu, and the associated flags for the various events. And on the Vietnam side, making sure that the band equipment can be stored off ship in a secure location for overnight and daily use. Next slide. Medical RFIs. Again, big item is the materials donation. Again, because we have certain legal restrictions. The number of personnel that are being supported, the names, and as well as the medical restrictions for each, and the various locations that are going to be used, such as the CDC is being moved currently, so we need to have the new location. And any of the credentialing requirements, we have the process established, but they need to still actually do the processing and credentialing to allow our medical team to work in country. Next slide. And that is it. Are there any questions? Thank you.
Thank you once again for all the planning teams and hard work that's gone into it. A little bit of background. So people have been doing this for a long time. I've kind of mentioned how sometimes the timeline is a little bit more acceptable and a little bit easier to work with. A lot of the work that was put together and put in front of you today was done in the past few weeks, if not the past few days. Our PDSS teams took off shortly after New Year's. Some of them just flew back right for the start of this conference. There's been an incredible amount of work, and we depart on Mercy in 82 days from now. There's a lot to finalize between now and then. And so while I do appreciate the incredible amount of work, we're really going to have to keep our foot on the gas as we go forward. Having said that, I want to get that out of the way so that we can kind of stretch over to positivity. Are there any final questions, comments, or concerns before I turn it back over to 73 for their final comments?
Hi, everyone. Again, I'd like to echo Brennan's words. Incredibly job well done this week. A lot of things happening, a lot of moving parts, a very complex mission coming up, and of course, the shadow of COVID always hovers above us. That could change what we've planned. But I'm fairly confident that with the team that we've assembled, that we can be flexible and execute the mission at hand and achieve all the objectives that was set forth by U.S. Indo-PACOM, our bigger boss, Admiral Aquilino. I just would remind everybody to just stay the course and just keep on trucking along. There is no dumb question. If you have a RFI or you have a question on how to proceed, don't keep that to yourself. There's plenty of people in this room. The collective brain trust here is going to find a solution. Again, Looking forward to the FPC and looking forward to seeing everyone here, as well as additional partners and host nation representation here in San Diego next month. And on behalf of Admiral Paparo, again, job well done. Thank you.
Thank you, sir.
All right. You guys looking at the schedule, we will proceed. We're pretty much on time here, so all those events are going to be moved up. So we're going to look to do the final thing, the final formal transition between our bosses right now. Before we get to that, though, a big shout out to the PDSS teams. I know it was fast and furious. We had some long, crazy days out there. Philippine team, I know you guys got back like pretty much hours ago, and here you are at the NPC crunching the data. So again, thank you for that. I understand we still have some more PDSF flavored work to do, but again, guys, thank you for all the work you did this week. I definitely appreciate it. You make me look good, and you made my life easy by doing these long hours and getting the product where it is. But I will not steal any more of my boss's thunder, so Captain Rockstead, over to you, sir.
Thanks, Greg. Thanks, Brendan. Good afternoon. I'm Mike Rockstead, the Deputy Chief of Staff at Task Force 73 out of Singapore. On behalf of Rear Admiral Sobek, again, thank you all for coming. One, I mean, that's a huge investment of time and resources that you are here providing your expertise and your level of enthusiasm for us together. You know, as I mentioned on Monday, a large part of this was just the relationship building, right? Commander Reyes had mentioned that as well. Getting us all in physically in one room so we can put names to faces and work together. And that's what I've seen throughout this week. A lot of collaboration, drawing on your individual expertise, you know, the experiences in the very community of effort that we'll need to support these lines of effort has been impressive. Now, I commend you all. As Greg had mentioned, we're working under tightened timelines. All the previous conferences were held later than normal. Everything else has happened later than normal. We still don't have quite all the information that we normally would have in non-COVID times. So I applaud you for your commitment and your efforts getting us to where we are. And I think we're there. So I'm grateful for everyone's involvement and the time that you've put in, that I can see this turning into a hugely successful Pacific Partnership 22. Best ever, indeed. So with that, Commodore, with your concurrence, I will turn over to you the responsibility to continue the final planning efforts as a supported commander.
Thank you very much. I really appreciate it.
I accept. I have no choice. No, I'm just kidding. No, I'm super excited. Captain Rockstead, team, Greg, country teams, and then our international partners who are here from Japan, Australia, Philippines, UK, and then our participants potentially in the future from Chile and Peru. Did I miss anybody? And then our interagency, Coast Guard, Army, Air Force. It's really amazing to see everybody here. And I guess one little bit of motherhood and apple pie. Things will change. Okay, you're planning stuff right now. Things will change. Things will drop off. Things will add on. Do not get frustrated, because even as things change, it will still be the best Pacific Partnership ever. And I know I'm super confident because I've seen you guys all at work. We are going to positively affect a lot of human lives. Positively affect a lot of human lives. I'm super excited about that. In addition, we're going to be meeting a lot of high-level national interests for each of our respective countries. So this is really a super big win-win. Okay, so again, thank you, Captain, 73 staff, everybody who's been here for the planning. Look forward to seeing many of you again at the FPC here in sunny San Diego, and many of you out on the fleet for this event. And without further ado, I guess I'll turn it over. Carry on the plan of the day. What do I give this back to you? All right, here you go.
All right, here you go, sir. Excellent plan.
All right, everyone. So this concludes the MPC. So thank you all for attendance. I know a lot of you are rushing to get to flights. One last admin thing. So for the ongoing OPTs, we have transitioned now. Brendan is the new Greg, and so he and his team will be running the OPTs from now on, much better than I could. So please, Brendan, have fun with that. But that being said, you plan to have one this week as well. So over to you, man.
Yeah, just a quick comment on that. We are going to continue those, even if not much new gets done between now and Wednesday. We want to set up that continuity. You will also be looking for a time for country teams to individually get together via Telecon and VTC and a couple of other admin things. Biggest thing I can ask for administratively going forward is, number one, make sure we have all your newest and updated points of contact on our sheet. Number two, please make sure the latest versions of the briefs are uploaded to APAD. If you can't do it from here because of the Wi-Fi, that's more than understandable, but let's try and get them on there for Monday. And for country OICs, if I could get a quick roundup with you in the corner after this is all done. I want to hit the ground running Monday morning. I want to make sure you know what we're looking at. If there's any final questions, comments, and concerns? Mr. Commander, permission to carry on the plan of the day.